Thank you, Mr. Chairman, and I want to thank the members of the panel for your testimony today. I have to thank in particular Dr. Collins for the slides. This description of the process that's leading towards a vaccine was most informative and colorful. I want to pick up on a line of questioning that Senator Murkowski described. And that's with regards to the growing sentiment, I think, across our country of people who are, if you will, anti-vaxxers, people who are avoiding vaccines. And I have been approached during visits to my state by people who have whole books that are written describing why vaccines are bad, why they're made from adulterated sources. And I won't go into all the details, but it's not like just a social media phenomenon. I mean, there are literally books out there that are written to describe why vaccines are bad. And I wonder if it does not make sense for our government to put out a very comprehensive effort to dispel this growing sense of vaccines being bad. And I don't know how you do that, but it would come to mind that you're doing that with regards to tobacco and massive advertising on TV. You could have debates. You could call in these people who write these books and have discussions with them, which are publicized. You could have much more aggressive campaign on social media. I guess the question I'm asking is, should we be doing more than we're doing, and what could we be doing to resolve the debate, the uncertainty that so many Americans have about the wisdom of receiving vaccine? And I'll ask Dr. Collins and the Surgeon General both if you'll respond to that.
Well, I'll start, but the Surgeon General will have a lot to say about this. This has been, of course, an issue for our country, not just in this season of COVID-19, but before that. And particularly, one has seen the consequences of that with measles, for instance, which in the year 2000, we declared that the U.S. had succeeded effectively in getting rid of measles. And now last year, we had more than 1,000 cases. And people have forgotten that kids die of that disease and continue to die in other parts of the world. I think we have benefited from the success of vaccines so that a generation has sort of lost track of the fact that these are preventing diseases that take lives. I just saw an estimate that if you looked at all of the children born in 2009 and you asked what would have happened if none of these vaccines had been available, 42,000 of them would have died. Imagine that, 42,000 kids dying for preventable conditions because vaccines were not available. Well, they're available now, but if they're not getting used, we're facing that same kind of terrible consequence. And it is heartbreaking, and I must say, frustrating, and sometimes even causes you a little bit of anger and frustration that this kind of misinformation is so readily spread by people who have another agenda. And we have a hard road to go to try to counter that when so many people don't see in their own experience the reason why this is such a life-saving activity. But I'm going on a bit. Surgeon General, please say what we should do about it.
No, thank you, Senator. And I'll very quickly walk through. The Department of Health and Human Services is using a three-tiered approach to improve vaccine confidence through research and evaluation, collaboration and partnerships, communication strategies, and knowledge dissemination. I put out an op-ed earlier this year with the Secretary and with CDC Director Redfield. We're working with platforms like Twitter and Pinterest and Facebook to make sure appropriate and accurate information is displayed prominently when people do a search. CDC developed Vaccinate with Confidence, a strategic framework to strengthen vaccine confidence. We're working with minority medical schools like Morehouse and beyond. But you mentioned vaccine resistance and the anti-vax community. It's important to understand that 90+% of parents out there are actually doing the right thing. And that when you look at the 10% who aren't, most of those 10% aren't in that anti-vax, or I say vaccine resistant category. They're in the vaccine hesitant category. And that's who we need to really work on. And we need to work on educating them and engaging them and being compassionate with them and patient with them to answer their questions. And I went out to Washington when they had the measles outbreak last year. And I found that when they had after hours conversations with parents, they'd come back 2, 3, sometimes 4 times. But most of those parents, when they got their questions answered.
Thank you, General. My time is virtually up. I'll just make one more comment, and that's for Dr. Collins, and that's with regards to the Russian announcement of a vaccine. Clearly, very little data. But are we evaluating the promise of vaccine efforts in other countries, and do they have much prospect for being of value to us?
We certainly are, to the extent that the information's being made available. And obviously what you'd like to see is a publication that's been peer-reviewed, and some of that is starting to come now from the vaccines that are being developed in China and Russia. I must say, the way in which the Russians rolled this out, declaring victory before they had gone much beyond a phase 1 trial, did not win them a lot of confidence in the scientific community. And so we really have to be insistent that if somebody is going to say this vaccine is safe and effective, that they have lived up to that very high standard. And I think our country establishes those standards, and others generally follow them as well. So yes, we're watching, but some might have said that the effort that Russia had put forward was putting a lot of people at risk, asking them to take a vaccine that hadn't gone through that. Some even called that Russian roulette.
Senator Romney, your time's expired. Thank you.
Thank you.